Guys, in this video, let us look at this forensic topic, dying declaration. Basically, this is coming under the section 32 of Indian Evidence Act. So you can see here, so on this person, it's written 32. He's 32-year-old, he's dying. So let us call it as section 32 Indian Evidence Act. That's just a way to remember. Okay, so section 32 Indian Evidence Act. So who and all can take this dying declaration? We'll come to that. First of all, what is dying declaration? It is a written or an oral statement of a person who is dying. As simple as that. A written or an oral statement of a person who is dying. As a result, means he is dying as a result of some unlawful act, and he is talking to you about what? The cause of his death, the circumstances of his death. He is talking to you about that. Okay. So, what is dying declaration? It's a written or an oral statement of a person who is dying as a result of an unlawful act. He is discussing with you what, he is telling you what the cause of his death or the circumstances. Okay. Recorded by whom? Recorded by magistrate is preferred. This is the highest priority here. Actually, magistrate plus doctor plus 2 witnesses is much preferred. Doctor if the condition is serious, and police and any person it says here. Procedure. So, any person can take the dying declaration, it says. Okay. Now, let us see the procedure, guys. Procedure. Preferably, dying declaration should be recorded by a magistrate in presence of a doctor and 2 other witnesses. Doctor and 2 other witnesses, it's there. That is the best. Okay. Doctor should certify that the person is conscious, his mental faculties are normal, and he is mentally sound. This is compos mentis. So this doctor should say that this guy is mentally sound. What is that? Compos mentis. Okay. Then, no oath is administered. No oath. Why? Because the dying man is always considered to be telling truth. This is what is believed. Okay. Then, statements should be recorded in person's own words without any alteration in terms of phrases. So, own words they have to use, not your words, their words. Okay, own words should be taken. Don't change the phrase. Whatever phrase they're saying, same thing you take, no alteration. Declarant should be allowed to give statement without any undue influence, prompting or assistance. You should not prompt, nobody should assist. That without any influence, this guy should give. No leading questions. Again here, no leading questions should be asked. No prompting, etc. No leading questions. Actual question asked and answer should be recorded. Both question and answer should be recorded. Then, statement made must be a fact, not opinion. Should be a fact, should be recorded, not opinion. I think and all, no need. What happened? Fact we need to know. Okay, we don't want opinion. Facts needed, not opinion. Okay, then if somebody is giving an opinion, then you should ask for the facts. If recording after recording, basically you should make this person read it. You should read it to him. He should sign or he should put a thumb impression. Okay. If possible, it should actually in the beginning itself it should write. The dying person should write if possible. Okay. That's why it said oral or a written statement of the person. Should write if possible, else read to that person what you have written, and he should sign it. Okay, sign or thumb impression. Okay, then if declarant is unable to speak but he makes signs, you should record it as verbal statement. Okay, verbal statement can be taken if he is not able to speak. So, while recording, if the declarant becomes unconscious, the recorder must record as much information as he can, and he has to sign it. Okay. If doctor has recorded declaration, then it should be sent to magistrate in a sealed cover. So, you will send the declaration in a sealed cover if you have taken it. So, person recording declaration will have to give evidence to court to prove it. So, if you have taken it, then you have to go to court and prove it. You'll have to give evidence in court. Then what else? Still so many points are there in procedure. It is accepted as evidence in case of death of victim in all criminal and civil cases. Okay. So it is accepted as the evidence in case of the death of the victim. However, if the person survives, the declaration is not admitted, but it has corroborative value. Okay. So if person dies, it is evidence. If person survives, then it has corroborative value. Guys, remember you have to take and send to sealed cover. Sealed cover you will send to magistrate. Then you will be called as you'll have to go as evidence in court and prove it. Okay, that you have taken this declaration. If person dies, it is evidence in the court of law in both civil and criminal cases. And if person survives, it has corroborative value. So what is the medico-legal importance? Dying declaration is an important documentary evidence in cases where victim succumbs to injuries sustained. So if the victim dies, then it is a documentary evidence. Guys, pay attention here. Currently we are discussing what? Dying declaration, right? But if it is, there is something called as a dying deposition. In dying deposition, what happens? Did that? Oath is administered. Guys, this is dying declaration. Remember, in dying deposition, this is much superior. Okay, here oath is administered to the person and cross-examination also happens, and this happens in front of a magistrate. Okay, it happens in front of a magistrate and a lawyer. Okay. So, the dying deposition is superior, remember. What you have studied so far was what? Dying declaration. This is not that superior because oath is not administered. Okay. So, have you understood this topic, dying declaration? That's all for now. Bye-bye.